Hi, everyone. Thank you, Vanessa, for that great introduction. And we're going to get started with the webinar for today. So, thank you all for joining us either here or virtually. Or as a recording later on. But today we're going to be talking about your heart, your life, embracing heart disease prevention with the heart truth. Next slide, please. And just to kick it off, we'd like to just start with some numbers and statistics so that we can really understand uh, the magnitude of what diabetes is and how diabetes also relates to heart disease directly. At NCFH, we have several initiatives and training and technical assistance support for health centers, and part of what we do is support them in their diabetes initiatives. So, uh, do we continue to work in this type of initiatives? And even though sometimes it might be the same information or repetitive, but we know that at the same time, there's still so much to do, right? Our job is not ended, and we need to continue pushing forward on diabetes prevention and control. And we have some data here of the estimate national cost of diabetes from 2022, and it speaks for itself. If we have over 400 billion with a B dollars of money spent on diabetes. That includes direct medical costs, and it also includes indirect costs. So in addition to expenses like medication, hospital stays, loss of productivity, all that is inclusive in that $400 billion expenditure. And this is for a year, right? So, what is included within the direct medical cost? It includes expenses like medications. We all know that diabetes has a there's the insulin and other diabetes auto control medications as well. There's hospital inpatient days, there's nursing homes, there's office visits, emergency room visits, and at the same time also the indirect cost of diabetes, which is a loss of productivity, right? Due to work absenteeism. So if you cannot go to work because your blood sugar is high and uncontrolled, then you have a the loss of work. So you're not working, you're not making money. That's a direct cost to your family and to the economy. There's a reduced productivity at work. If you're not feeling well, then you're also not giving your 100% either at work or at home. There's unemployment for chronic disabilities and premature mortality. All these are costs associated to the diabetes, and as well there's the cost of is this cost is often carried in a disproportionate way by the most vulnerable and underserved communities. So uh, and it at the same time it leads to all these different complications, health complications. So people with diabetes are at risk with serious complications, and to that is the reason why we're going to be talking about heart disease today, which is one of them. Next slide. So diabetes and heart disease are closely related, right? Why so? Diabetes, as we know, diabetes, the basic definition of it is high blood sugar levels, right? So if we have high blood sugar levels, our blood throughout the whole body, which is in it touches every organ in our body, the blood is dense and thick because it has high levels of sugar. That causes a really strong stress in the body and in our circulatory system. So it affects directly to our heart, making it that people with diabetes has 3 times more likely to die of heart disease. This is one of the leading causes of that for people with diabetes. Next slide. So, what causes heart disease? Well, there's some shared risks that are the same for diabetes and the same for heart disease. These shared risks are high blood pressure, high LDL cholesterol. Uh, there is also and the diabetes itself by itself is one of the risks for heart disease. And we all know and have been listening recently and over the past years how the obesity levels within our communities have been the levels have been increasing, and not only on older but also younger patients, right? On younger adults, on kids. So obesity is one of the main causes of and risks of heart disease, as well as goes hand in hand with a lack of physical activity, of smoking, and chronic inflammation. So for this, we have a visual there that's how we can see um, the high blood sugar can cause damage to the walls of the blood vessels. So the blood sugar, when it's thick, it leaves residue in the tunnels of the vessels, and we can visualize this almost like a swim noodle. We used to do uh, this we used to use it as a tool for diabetes self-management education classes, and you can use a swim noodle, and you can use even the pink ones. Those are the most representative ones. Cut off a piece of the swim noodle right now that we're going into summer, so
Mhm.
they're everywhere. And you can cut and in with the plate with a little tub of play-doh. You can demonstrate how that play-doh stay stuck. It starts sticking to the walls, to the inside walls of the blood vessel, and starts creating that buildup of fatty material. Over time, these blood vessels narrow, and the blood flow in the middle, it's reduced, and it puts all that strain and stress. So there's that's a very visual way, us as facilitators of diabetes and health education, we have to think of ways that we can represent that, and that's one way. And you can visually demonstrate how it affects you. So the good news is that there's all these modifiable risks, most of them, and that's what we can work on as well. And takes me to the next slide, which is educate. We need to do what we can to change those modifiable risks and help our patients and communities work towards a healthier health outcome and have a healthier life in general, right? Healthier outcomes. And we need to educate, educate, educate. There's a lot of work to do on that, and so that patients can auto be capable of auto managing their diseases, self managing their disease, and live with it and avoid complications. So for that, the reason that we're here today, we have our guest speaker.
Mhm.
Thank you. And Karina Guzman is going to be joining us today, and she supports health education efforts across the National Heart, Lung, and Blood Institute. In her role, she promotes heart health throughout the development and dissemination of resources. And Karina received her MS in health education, health promotion management from American University, and her bachelor's at the community in community health education from the University of North Carolina in Wilmington. So we're really glad to have Karina today, so that she can share with us a little bit more about how we can educate our patients on heart health. And she's going to go over the great resources that the uh, National Heart, Lung, and Blood Institute has for us. So, Karina, I'll leave
Okay,
it to you.
wonderful. Thank you so much for that great intro, Maria, and for setting the base with the great information. So I'm going to have a little bit of an intro as well, and then we'll dive into the resources. But just to give you an overview of what I'll be talking about, we're going to learn a little bit about NHLBI, or the National Heart, Lung, and Blood Institute. We're going to learn about the Heart Truth and what that program is. Similar to Maria, we're going to touch on some fast facts about heart disease, but also heart healthy living. So we're going to look at both. And then we'll jump into the resources that are available to you all for your communities, your patients. And then I'll do a little bit of screen sharing so you can really get a good look at the resources and think about how they'll be applicable to you in your role. And then we'll open it up to Q&A. So yeah. Okay, so just quickly, again, I don't want to spend too much time here, but I know it's a mouthful, National Heart, Lung, and Blood Institute. So we say NHLBI for short, but NHLBI is part of the National Institutes of Health, or NIH. You may be familiar with them. And our goal is to provide a global leadership for research, training, and education programs on topics such as heart, lung, and blood disorders. And so today we're only focusing on a heart related program, but I did just want to share that we also cover other topics. But specifically, our health education programs help, educate the community, create awareness, and just overall the goal is to create a positive change to the community through public health. All of our resources, messages, and programs are all science-based, and the goal, again, is to communicate health information to our different communities. So as I mentioned, we have different kind of programs in our portfolio, but today we're only talking about the heart program, and it's called the Heart Truth. It is a program that it's been around for a little bit. It started in 2002 originally to address heart disease as a leading cause of death in women. But since then, we've evolved and we connect and reach out to multiple communities, not just women, but that was a little bit of how we started. So yeah, again, it's a health education program to promote heart health or to create awareness of the different risks of heart disease, but also to empower you to feel good and like you know what to do to take action for your heart health. So yeah, I kind of mentioned this, but I want to reiterate that all of our resources are free. They're science-based and they're available online. We'll talk a little bit about how you can access them later. But if you're thinking like, oh, I don't know if I've ever heard of NHLBI or not, a popular, well-known initiative that we lead that you may be familiar with is American Heart Month. So that takes place every February, and it's like we lead the initiative nationally. So that's a really big effort. So you may be familiar with that, or even our National Wear Red Day, which occurs on the first Friday of every February, where people, wear red to promote heart health. So yeah, and then one more kind of like visual token here, there's our red dress logo or our red dress symbol. You may have seen that as well. That's a national symbol for women and heart disease. Again, it was tied to our early roots when we started out for focusing on only women and heart disease, but again, we have expanded our reach. But yeah, that's a little bit about NHLBI and the heart truth. But yeah, let's kind of pivot a little bit again to these fast facts. So what is heart disease? Just keeping some basic facts here, and then we'll talk about the healthy behaviors as well. But just as a for all, so that we're all on the same playing field, it just generally it's heart disease is a general term for conditions that affect the heart structure and how it works. We're talking about it today because it's the leading cause of death in the US for men, women, and people of most community groups. So it's very, very prominent and something that affects all of us, those that we know, our friends, our family, and it's just very common. One person dies every 33 seconds from cardiovascular disease. So that's very, very often. And then just one more note here, but there's different types of heart disease, but coronary heart disease is the most common. So you may have heard of that one a little bit more. But the good news is that heart healthy living or healthy lifestyles can help offset some of the can help offset heart disease. So getting enough sleep, eating better, stopping or not smoking at all, maintaining a healthy weight, or being physically active. Those are behaviors that we can do as individuals, as communities together to promote heart health, and to prevent heart disease. So because we know that, the Heart Truth, our health education program, we really focus on those healthy lifestyles through education and awareness so that people know what they can do and what they can do in their communities as well. So here I'm just going to show you a sample of our resources, but we have really, really comprehensive collection. These are just a few. But here, let me see if I can click 1 second. Um, Okay, I think you can see my pointer now. But over here we have like a fact sheet, this very colorful, something that you can print or we can ship it to you for free as well. Oops. And you can share with your patients, with your community members. We also have gifts here for social media use, or if you want to add it to your website resources. We have these state cards as well. These are really popular on social media for our organizations. This one's focused on Texas, but we have one for every state. And again, it just creates awareness about, how many people in the state have coronary heart disease. We have this blood pressure wallet card, which is really, really popular. I think it's our most popular resource. And patients, people, communities love to use it. You can print it and have it carry it with you, and it's just really helpful. And then here, just sharing, we have resources in English and Spanish. So just using an example here. Here, and a few more resources. I just wanted to kind of showcase the range of topics that we cover within heart health because it is so broad. For example, this fact sheet talks about healthy weight. We have one on cholesterol and heart smart basics. So those are kind of the topics that you can expect to see with our program. Okay, so now we're going to dive into what really this presentation is about, but our community health worker resources. So we have a series of 4 different community tailored resources. So the one that we'll be focusing on today is Your Heart, Your Life. This is focused on the Hispanic Latino population. This is our first or our most recently updated one. So this is a brand new, it was revised and published this year. So we really want to highlight it because it is new. But previously we had an older version that was like about 20 years old. So we're kind of going through each one and updating. With Every Heartbeat is Life is our African American tailored um, toolkit. This one was updated last year, so it's really new as well. So these are 2 newest ones. And you can kind of see here with the visual graphics, these are a little older. They're 20 years old. The information is still accurate, but we are in the process of refreshing these as well. It just takes so long because there's so many resources within. But currently, we're working on this one, honoring the gift of heart health. This is for our American Indian Alaska Native communities. And then we'll be working on Healthy Heart, Healthy Family, which is focused on Asian Americans, Pacific Islanders, and Hawaiians. So just letting you know, we have this suite of resources um, tailored to different communities, and it's like a toolkit or a guide to help community health workers or outreach workers or health center staff kind of have resources on heart health that you can kind of plug into your daily work or your events, things like that. But again, today we're focusing on this one because it is our newest, so we're really excited. So your heart, your life, it provides information on and guidance on how to integrate practical, healthy lifestyles to improve the heart health of Hispanic or Latinos as a group, as a community. And it has everything you need to kind of facilitate that education program or awareness. And it's also available in English and Spanish. And then there are a couple resources that are bilingual, and I'll show you that in a second. But each toolkit, it has so many resources, and you can choose to kind of work through it from end to end, like one complete program, or you can pick and choose the resources that are most relevant to you and your community. But it does include a full manual that has like notes for you as a community health worker, as an outreach worker that help you. It tells you like what to say, how to facilitate, what activities to incorporate. Has like tips, like it just has everything you'll need to facilitate this program. There are also picture cards to, appeal to the different types of learners. Some people learn better through visual, through images. So we have picture cards that kind of help explain the different topics that we cover. We also have a booklet, and I'll show you in a second what these all look like. And then one of my favorite resources are the recipes. We have heart healthy recipes and these are bilingual or in English and Spanish, but it's one resource. And then we have promotional materials so that, let's say in the event you're interested in facilitating your heart, your life in your community with your patients. And you would like to create awareness or promote it. We have like a flyer ready for you to go. We have social media posts that you can kind of plug and use. So it's really comprehensive, and the way you use it really depends on your needs. But I'm going to pause here and I'm going to share my screen. I kind of just want you to see how these resources, like where they look and kind of where they are. So I'm going to turn my gaze this way just so I can follow along with you. But if you go to the NHLBI site, it's really easy to get to these resources. You can just, on that first or on that second tab, you can click Health Education. And then from here, you click Education Programs and Initiatives. And then in the heart category, you scroll down to community health worker tools. And so this is where you'll find kind of that screenshot I shared earlier with the suite of different curriculums. And you can easily click whichever one applies to you or the population that you're serving. But today we're going to look at Your Heart, Your Life, as I mentioned. And it takes you to this page, and it has everything that I just kind of listed in that one slide um, all here. And so you have your full manuals, English and Spanish. So let me just show you what that looks like. I'm going to move a little tabs here. This is an example of the manual. It's in PDF. I kind of bookmarked this section because it just wanted to show you like the kind of tips and guidance that it gives you. For example, this page is how to use this manual. It tells you all of the sessions that are here. It tells you in the appendix what you can find. So it's really like a how-to for you, but it also has a content that you need to share with your community so that they can improve their health or their heart health through their behaviors or through education. But as a community health worker, it gives you like a heads up on the session outline. It tells you how to talk about the topics. It has these little symbols here that kind of help you, know what's next, if there's an activity, if there is a training, if there's a recipe to share. Yeah, and it covers everything. It's really comprehensive. I went here, but I wanted to show you there's also, our table of contents has a different session. So back to this main page. Oops. Back to this main page. I just showed you the full manual, but let's say that you're like, oh, Karina, like this manual is way too lengthy. Like I do not have time. I need to I'm interested in one topic, cholesterol, and I want, what do you have on cholesterol? So you can come to the same webpage and you can just click view individual sessions instead of going to the entire manual. So this way you can really just access and pull the information that's most helpful for you. And so let's say that you are interested in seeing what the manual has related to cholesterol. You can easily kind of scan through the different sessions. Session 5 is a cholesterol section, and you can open the modules, the picture cards, and you can see all of the handouts as well. So maybe you don't have time to lead a weekly community health worker like session, but maybe this handout on breakfast choices really aligns with a like heart healthy dishes that you're promoting, things like that. So yeah, so you just want to show it. You don't have to be intimidated with the entire manual. You can pick individual sessions. And then we have our picture cards as well that I mentioned. We have our booklet, and we have our recipe book as well. I kind of downloaded these just so you can see, but this is a recipe book. It has like the different categories, but let's say that you're really trying to promote heart healthy eating with your community and you're looking for some recipes that are heart healthy, but also, you know, relevant and pertinent to the community that you're serving. So you can come here. Let's say you're looking for entrees, you can just click it and it shows you, again, this is a bilingual recipe book, so it shows you like the different recipes that there are here. And of course, in the Hispanic Latino community, there's so many countries and cultures that are represented there. And so you'll find a little we tried our best to have a little mix of different recipes. So you'll have like Puerto Rican yellow plantain and meat casserole, but you also have like Chilean corn and meat pie. So a little bit of the different recipes, and again, really beautiful pictures here with very clear ingredients, and we try to keep the steps very simple as well. So whether this is something you're sharing with your community or you're doing like a live cooking demo, things like that would be a great use. And let's go back. Let's see what else there is. Oh, and then in addition to resources that you can use to share with your community, there's also resources for you to help get the word out or promote it. So, for example, social media resources. If you were to host a Your Heart Your Life session in your community, you might want to, promote it through a flyer or through social. And we have that all covered. So here's like an example if you wanted to post on social, like in the next month, we're going to be doing a Your Heart, Your Life session sign up. You can use any of our graphics. We have them in English, and we also have them in Spanish. And in addition to that, if you click right here, this little link here, it also comes with like the caption or the post text. So, yeah, just everything that you'll need will be here. I think it's just a matter of kind of sorting through all the resources and finding what is it that you really need. But yeah, okay. So let me go back to the PowerPoint slide. One second. Okay, perfect. Um, okay, so I know I did a lot of talking. I think we'll open it up for questions in a couple more slides, but I just wanted to kind of bring it all back together and how this applies to you and how you can see yourself utilizing these really, really great new resources. So the first way I can kind of see you using these resources as an outreach worker, a community health worker, health center staff member, community liaison is to become an instructor. You can become an instructor and you can lead your own Your Heart, Your Life sessions for your communities. And like I mentioned, it can look like doing it, from session one all the way to session 12, or maybe it's you're picking a couple sessions that are most relevant and prominent to your community. So that kind of leads to my second point here. You can also just pull sessions, maybe there's only one session that you have time for or that makes sense for your community. Maybe there's only one pressing, area. Maybe there are time barriers, and one session is what works best for you. So you can, like I showed you when I shared my screen, you can just select the sessions that work for you. You don't have to commit to the whole thing. Additionally, I also mentioned this, but you can pull handouts. So let's say that it is a month that you're focusing on diabetes. You can come into this toolkit and see what kind of handouts on diabetes are there, and you can just pull those out directly, share with your community or your patients. And then the other way that you can kind of use this is you can refer your patients to the web page. So the same way that, you can look through sessions and share handouts, I think you can share links or just like the Heart Truth program, Your Heart, Your Life, resources to patients that can also be really helpful to them, or sometimes for family members, like share resources with other family members. So however you think that, the resources make the most sense, I think there's no right or wrong way to do it, I think is the point. These are just some ideas of how people have used it in the past, but however it works for you is the way that it can be. I also, getting ready to wrap up, but I just wanted to reiterate that we are talking about the Your Heart, Your Life community today. But we have a lot of different resources that are catered to communities, including fact sheets, infographics, and social media graphics that kind of cater to our different communities. I'm not going to share my screen right now. Well, actually, maybe I will. No, I'm not gonna share my screen now. I think I'll save it for later, but this link right here, that's in the slide deck, it takes you to another web page separate from Your Heart, Your Life that has all the resources that are specific to community. So it's really, really helpful. But yeah, I think that's it for my like presentation, but I'm happy to like take any questions. You can think about it and put it in the chat. We can get to it. But yeah, I'm happy to answer any questions and anything I can do to help these resources feel more like relevant to you, feel more accessible to you. I'm happy to talk about that. Um, and before we move over to that though, uh, just a contact part. So I mentioned that all of our resources are free, but I really wanted to share more information on that. So when you're online, you can um, like download the manuals or the handouts, things like that. But we also have an entire collection of resources, like all those other fact sheets that I shared in the beginning, that we print and send to you. Again, this is a free service, and it's a really nice way to get fact sheets when you're doing like a health fair or if you need to put some on a coffee table in the waiting room, things like that. So just knowing that beyond your heart, your life, we have so many heart health resources, and we also have it for lung, blood, and sleep. So just a good place to check out for free science-based resources. But I'll pause now, and I'll see if Maria's ready for the next session or if I should pause here and go
Yeah,
back to Q
thank you.
questions. What do you?
Thank you, Karina. Yeah, that'd be
Yeah.
amazing if you can go to the next slide. And
Okay.
that with when you mentioned that, it just answered another question that I had in my head, like how can I get these materials because they're amazing. So I'm really glad that you're able to print them and send them out to anyone who requests them,
Yeah.
because we all know that that's the additional resources that you have to spend into printing or. Uh, yeah, and it can get expensive, so it's a big help, so we appreciate that. And after the great information that you shared, it takes me to, do you remember I shared with you this photo? I was out in a community at a summit, and I saw this, and there was this group doing the presentation on their program, on their heart program, and they shared the materials that they use. And I just loved to see, what Karina's talking about, what they all developed, and the amount of work that it goes into developing materials for the community and being able to see them in use. It was amazing. So I really appreciate it, and I got really excited, and I even shared with Karina, like, you look, the resources that you all created are being used. So uh, I think that there's a lot of lessons learned and best practices in implementing effective care and
Mhm.
health education programs for patients, and just being able to use these great resources for free. It just helps out so much. So let's go into a little bit of the lessons learned, just to recap everything that we have heard today and put into perspective that we saw there's different materials for different communities. Sometimes one size education doesn't fit all, right? Or sometimes you can. So community context really matters. Knowing your community and knowing what works best for you and for your community is so important, and being able to use the tools that work for you, right? That someone else is also thinking of that same thing. So being able to do that, to give that ongoing support, so that patients and communities can boost their health outcomes. Uh, using incorporating a little bit of that new technology that we sometimes like are in my generation is not so used to it, but uh, just going into digital tools that help, and knowing who they are for, if they're able, like, they're not for everyone, but if you're seeing younger patients, their mind is digital. So going to digital tools works best. And just trusting, that over time, that relationships is going to be built, and trust is going to be gained from the patients to the facilitators and to all of you as health center staff and all. And as I said, use visuals and simple language that goes along with knowing your community as well. Involving family and caregivers is very important. So just not giving this health education to the people affected, but also their families, right? Also their caregivers. It's make it a family thing. Make it and make the recipes a new family tradition. To cook together and to be healthy together, involving everyone, and that's where success is gonna come from. And reinforce messages constantly, and be consistent, and combine group and one-on-one sessions. Sometimes uh, whenever I worked in diabetes self-management education classes, there were some sessions being held at the Walmarts, outside of the Walmart, right? And there were some sessions being held in the health center or in the hospital. So, uh, you know, and hearing Karina and her tools and what all the tools give is flexibility. So being flexible, knowing what you can use and how you can use it is great and a great benefit. NCFH has a diabetes resource hub where we have a lot of different materials and we do cover diabetes complications as well. We have a lot of tools for you along with the ones that Karina just shared, but different organizations, trusted organizations, because that's important, right? To know where to look for our information and guide our patients to the correct information as well. So I really encourage you to look at the Diabetes Resource Hub and use those resources. And just to wrap up, and we want to give you a thank you for being here. And we're gonna be stopping here for those who are listening in. But for those who are live with us, we're gonna be going into a Q&A, and you can join us in a bit. And